Hi, my name is Dr. Tinsley, actually Elton Xavier Tinsley. I'm a native of Chicago, actually grew up on the South Side. My father was a CTA bus driver. A couple of things that people don't know about me. One, I spent 4 years in a seminary. Two, I think my life's calling has something to do with women. Why do I say that? I've got sisters, no brothers, nieces, no nephews, daughters, no sons, and I see about 100 women a week. That's called an outpatient. But seriously, I enjoy the work that I've done over the years. I started off in general surgery, did a lot of internal organ surgery. I left general surgery and went into trauma surgery. I was a Cook County Hospital surgical intern. I'm actually more proud of that than all of my additional university training. After general surgery and trauma surgery, I actually did research, gastrointestinal immunology research. I took that immunology research and then did a burn fellowship and studied the effect of burns, major burns, on the immune system. I had the fortune one night of being on call at the Washington Hospital Center in Washington, D.C. As a requirement for my research, which they actually funded. I was required to take call in the burn unit. It just so happened at that particular night, that one night out of my 30 years of practice, that one night, the surgeon on call for trauma was actually the chairman of the burn unit. So the chairman of the burn unit, who was a Navy surgeon, a military surgeon, was on call for trauma, and I was on call for burns. And it just so happened that one night, a young man got into a car accident and his car exploded. He had 30% total body surface area burns, a ruptured spleen, and a fractured two-bone fracture of his right lower extremity. We did not admit him to the trauma unit. We took him to surgery, we did a splenectomy, and we admitted him to the burn unit. We did split thickness skin grafts to his partial thickness wounds, and then we plated and screwed his ankle fractures. We did every single aspect of surgery besides cardiac. However, there was significant resuscitation. Besides cardiac and perhaps neurosurgery, ourselves. Being able to manage an entire patient ourselves without having to call for help was something that really got me excited. That night, I decided I wanted to be a reconstructive surgeon. So I have operated on every single organ in the human body, including the brain and the heart and newborns. That led me to pursue a career in plastic and reconstructive surgery. When I went in plastic and reconstructive surgery, I actually went to be an academic plastic surgeon. However, after a few years in academia, I wasn't cut out the kind of politician you need to be to stay in academia, and I decided to go into private practice on the south side of Chicago, which is where I'm from originally. Well, guess what black folks on the south side of Chicago want? The same thing the white folks want. Liposuction, tummy tuck, nose jobs. I was so uncomfortable with cosmetic surgery. I could make a nose in somebody that had no nose, but to take a normal nose and simply beautify it was not something that I was comfortable with. I actually quit my practice and went back and did a fellowship in cosmetic surgery, then came back the following year and opened up my business. And I'm happy to say today, this is my 30th year of practice.